welcome back to my channel. My name is Deanna Tikhonov and I'm a women's health nurse practitioner. I know that's a mouthful. If you have no idea what that is, please check out my first video where I introduce who I am. I'll link it down below for you to take a look so you're wondering, who is this person? I am a women's health nurse practitioner. That means that I am able to see my own patients, diagnose, treat, and I've specialized in women's health. So everything OBGYN is what I do, with the exception of surgeries and delivering babies. So that's a little bit about me in a quick nutshell. On today's video, I'm actually going to be talking to my prego patients out there, or women that are considering getting pregnant in the near future with everything going on currently with coronavirus pandemic. So, I know it's a very scary time out there and there's a lot of new information every day. The guidelines are constantly changing. I feel you. I'm not immune to this just because I'm a healthcare provider, and I know that it is a difficult time to be going through, especially if you're pregnant or considering being pregnant soon. So what does this mean for you? You may or may not have seen or know that currently there is absolutely no evidence that there is any crossing through of the placenta of the virus, meaning that if you're already pregnant and you get coronavirus, there is no evidence that the virus is going to pass through the placenta and affect the baby at all. All of the cases of coronavirus that have been occurring, if women are pregnant and test positive, the babies have not been positive themselves at birth. Now, once the baby is born, if you are a woman with coronavirus, there is going to be some rules in place as far as limiting your exposure to the baby, distancing yourself, wearing masks, which is pretty much standard now with everyone currently. That was different from a few weeks ago, but currently pretty much all states, I would say, are requiring people to wear masks at all times. So that kind of is already happening. But as far as if you are positive for coronavirus and you're pregnant, you are likely going to be kept at a distance from your baby, depending on how sick you are, maybe not even able to see the baby in the beginning. And this is, I know it's an unfortunate thing to have that occur, but the worry is that if the baby is exposed at that point, they could get very sick from the virus because their immune systems just haven't fully developed yet. So that is the thought behind that, and keeping social distancing and practicing hygiene and wearing the mask, all of those things have shown to help dramatically and reduce the chances of the baby being exposed. And once the woman is goes through the virus, and making sure that it is not becoming more severe, which again, 80% of people contracting the virus, that has really not changed, that 80% of the people contracting the virus have mild symptoms and recover well, not requiring hospitalization. So, with that being said, the studies that have, the studies are very new, right? So they're coming out and they're based on small populations of people. And what we are seeing is that studies of pregnant women seem to be mimicking the same statistics of non-pregnant people, meaning that approximately 80% in some of these studies, and I'll link it down below, 80% of pregnant women that had coronavirus had mild symptoms, which is the same kind of prognosis that we're seeing among the general population. So that is reassuring. Although I mentioned this in one of my last videos about coronavirus, women who are pregnant do have slightly decreased immune systems. That is just a part of being pregnant. So it does put a pregnant woman a little bit at higher risk for developing a virus and getting a little sicker than the average person. But overall, from what we're seeing, is that pregnant women are overall doing fairly well with coronavirus, and it's not getting to a severe point. So that is something to keep in mind. I've heard some talk about worry that it's going to cross through the placenta, and that has not been found at all. So that is some reassuring news. So if you end up with coronavirus towards the beginning of the pregnancy, chances of you having to worry about it when the baby is born is unlikely. So that is a positive, versus if you get it later on in the pregnancy where there is a possibility you can deliver, that is a little bit more risky, and it probably will require separation in the hospital and at home potentially. Does not mean you can't breastfeed. Currently the CDC is saying that it's still okay to breastfeed as long as you're wearing a mask, keeping good hand hygiene, of course not sneezing, coughing, directly close to the baby. So those are things to keep in mind if you are pregnant or considering pregnancy. It's not to say that you should not be getting pregnant right now, but it's just things to consider. Social isolation is still key right now for everybody to help minimize the spread of this virus and slow things down. So I can't stress enough how serious everybody does need to take this, that we are staying home as much as possible, utilizing delivery services if we can, staying home with whoever we live with, and that's it. You know, I know it's hard when you have family and you think, well, I just want to see them for a little bit, it's just my family. It doesn't matter. You know, this is something that if your family was out somewhere and they were exposed to someone and have no idea, and it's a domino effect. So it's crucial that you are overall trying your best to stay home, only going out for essential things that you need. Hand hygiene is still number one. Wearing masks and covering your face, nose, and mouth is now the recommendation through the CDC. There is a link below that tells you how to make your own mask, or if you have access to a mask that you're wearing that, especially when you're out at grocery stores, places where there's a lot of people, is crucial. Even things like running and walking outside, you know, now that it's getting warmer, more people are doing that, and it is important that we're still practicing social distancing and considering wearing a mask while you're out, because you just don't know if somebody had sneezed. There is data showing that the particles of the virus can still be in the air as you're passing by. So another reason to just really take this seriously: social isolation, wearing masks, covering the nose and mouth, hand hygiene, and doing healthy things to boost our immune system. So still really important that, you know, while you're home during this time, that you're making your health number one. Getting 7 to 8 hours of sleep per night is key. You know, not staying up late binge watching Netflix and going to bed at 1 in the morning because you can, because that is going to impact our body's immune system. So sleeping regularly, 7 to 8 hours a night, drinking lots of water throughout the day. No excuse anymore. If you're home, you can use the bathroom as much as you need. So that is something else to keep in mind. And that you are eating throughout the day, eating lots of fruits and vegetables in your diet. And this goes whether you're pregnant or not pregnant or considering getting pregnant. All of those things really apply, even if you're a man or a woman. It's key for our overall health, and it's crucial, especially with this virus going on. I think it's a big eye-opener of really tuning into ways that you can do a little bit of a better job of ensuring that you are healthy and making healthier choices. This doesn't mean drinking a glass of wine every day because you can, because that as well causes a slew of issues such as inflammation, spikes in sugar level, insulin resistance, inflammation, and just not impacting your ability to sleep. It affects your circadian rhythm. I mean, so many things. So this isn't a time to just go off, you know. We need to practice self-care here and do what's best for our bodies to ensure that we reduce our risk of being really sick from this virus. So those are things to keep in mind. If you are pregnant right now and you're experiencing symptoms, any cold-like symptoms, it's so important. Don't feel silly. Call your healthcare provider, whoever you're seeing. Let them know what's going on. Keep them informed. That's so important, that this isn't something that you just kind of, it's fine, it's no big deal. And I speak for my own practice, and I'm sure all OBGYN practices out there, we want to really make sure that you are safe and that we're keeping an eye on patients that potentially might have coronavirus. So if you're just not sure, if you have a silly question, there's no silly question. You call your office and let them know what's going on. Of course, the emergency things like shortness of breath, a fever over 101, that is not going away with Tylenol, chest pain, feeling extremely fatigued where you feel like you're gonna pass out, anything with breathing difficulties or a fever that is not going away, you're going to the emergency room. It's very important. You know, again, this is not supposed to replace seeing your healthcare provider. It is also best to let your healthcare provider know what's going on, but I can almost guarantee that if you have symptoms severe as that they will advise you to go to the emergency room. The great news is that testing is becoming more readily available among urgent care centers, hospitals, and it's even a new test modality is available where it will be through the saliva rather than a nasal swab, which will also likely speed things up, and it's also a quicker turnaround time. So these are all great things of progress. It's important to think and recognize the positive efforts that have happened over the past few weeks. Again, so much has changed, but I just wanna tell my prego patients out there and people that are considering getting pregnant that it will be okay if you're following the instructions that the CDC continues to put out and following legitimate health resources. You want to be careful. Don't be paying attention to a Facebook post that may or may not be accurate information and can cause you more anxiety. So these are all just things to keep in mind during this time. My heart goes out to all of you, sending you a lot of health, love, peace during this time. If you like this video, please make sure to give me a thumbs up, like and subscribe to my video and my channel, and check out my Instagram at the ladies guide. I just am all tongue-tied right now, but we're all human, so I'm not gonna edit this out. I'm gonna leave it as is. This is just one of my awkward, silly moments here. So if you've stayed watching for the duration of this video, thank you so much. I appreciate all of you and everyone who supports me and my channel. Spread it to your family and friends. Let them know. Empower everyone so we can make more informed health decisions for ourselves. Again, thank you so much, and until next time, bye.